I think that something that people don't know about working in child welfare is that we do not just remove kids all day, every day. That most of the time we're really just going into the home, identifying some needs and resources that families don't usually know that they have, and we're pointing them in the direction of the community that they can meet those needs and resources. A lot of times you're helping bridge the gap with support even for the families. They may not realize the supports that are offered in the community or that people provide in the community. And so I think it's kind of interesting when you see stuff on the news and the things that you hear about DHS, everyone just assumes it's us removing kids all the time, when that's actually probably like a very small percentage of our cases.
I definitely don't think people know that the decisions are ultimately up to the court. Whether a child is taken into custody is up to the court. If the child returns home, we can make the recommendation, but that's ultimately up to the court. So I don't think many people realize that.
I don't think people realize how heartbreaking it is as a worker to do this job. And that's not all the time. I mean, I go home and I'm happy because I have a mom who called me and just got out of, a 90-day rehab program, and she's back with her baby and she's doing well. But then I also get those other heartbreaking phone calls, or I walk into those heartbreaking situations and homes, and that is something that I don't think when I started I was ever prepared for, the level of secondhand trauma and compassion fatigue that can come. But it does, and that's okay. You just reset and you refocus and you get back to doing what you can do well, which is helping them.
So reunification is something I don't think that people talk about very often outside of child welfare. But our goal from day one is to get the kids back home. And our goal is to do it safely. I think a lot of people think that a home has to be perfect for a kid to go back, and that's not true. Nobody's got a perfect home. Nobody's a perfect parent. I mean, I can tell you, I can sit down with my parents on my caseload and be like, listen, I can totally relate to your frustrations. However, we have to safely parent. Like, you really have to connect on that level and be able to express to them, like, you're not alone. So I think that it's important for people to understand that our goal is reunification, and I know that people try very hard. And the battle sometimes is that individuals have had generational, social services and generational children being in the system. So there's already a negative perception of how or what's going to happen. There's the assumption that you're never going to get your kids back, but that's really, really not our goal. It makes me happy when I can get a kid home faster. It's better for them. It's better for everybody. These parents that truly do embrace what we're trying to do and help them, it's just so amazing seeing that change in them and their families, and they will come back and say thank you, and that's enough for me, just a thank you. And even the kids, sometimes it's not easy. Sometimes the kids are still a little bit concerned about going home. But when you consistently show them, look, there's help out there. It's not your parents aren't alone anymore. There's somebody there to help them. And there's so many resources in our communities that I don't think people realize are there. So that's part of the reunification as well, is setting people up for success and setting them up with resources that truly work. Not everybody wants to wake up and be an alcoholic. So what's going on for you? What can we do? Do you need counseling? What happened to you? And I think that's one of the questions that I always try to keep in mind. What happened to you? Not why are you doing this, but what's happened to you to create these moments that have led to this unsafe situation. So that's one of the things I want people to understand, is it's always about getting these kids home. And it's the best feeling when you can do that.